Thyroid is something that should be thought of if you've got significant tiredness, fatigue, you've been putting it down to a post-viral or post-COVID fatigue, you should definitely talk to your GP and make sure your thyroid function tests are checked. Hi, I'm Soji Swaraj. I'm a specialist physician. I'm an endocrinologist. So we deal with hormonal issues, diabetes, thyroid, metabolic syndrome, PCOS, fertility. So I consult here at East Sydney Private as well as the Integrated Health Institute in George Street. The thyroid gland is a crucial gland here in your neck, wrapped around your windpipe. You barely know it's there, and sometimes we can feel it when we examine you. It produces hormones, thyroid hormones, which go to every cell in your body, and they spark plug, if you like, your metabolism, your energy. To put it short, when the thyroid's removed, as we sometimes do, and people would say thyroid cancer, and thrown in the bin, if you don't have thyroid hormone production, within several weeks, you'll be dead. But it's famously lumpy. So thyroids can form lumps, and so basically people can feel a lump, and if you do, you should present to your GP and have an ultrasound. But that's the sort of thing that we endocrinologists have a look at. Contributes to your energy, your fertility, your growth. Baby's brain and IQ won't develop unless the baby's getting enough thyroxine from the mother. So in pregnancy in particular, I'm very paranoid about making sure her thyroxine levels are adequately managed. And pre-pregnancy, if there's any suggestion of an underactive thyroid, or she's got Hashimoto's disease, I very often will use thyroxine to get her levels right for the pregnancy. So commonly you've got underactive thyroid, where you're not producing enough thyroid hormone and you can be tired, lethargic, weight gain, dry skin and cold. And that's most commonly caused by Hashimoto's thyroiditis. That's an autoimmune condition where your immune system produces antibodies which are meant to kill bugs, but in your case come and attack your thyroid and cause either a painless or a painful inflammation and an underactive thyroid. Those antibodies can sometimes affect your joints and your general well-being. So it's important that when you're talking to your GP or your specialist that you talk about all your symptoms, not just the blood tests. The commonest cause of an overactive thyroid is Graves' disease, named after Robert Graves, where your immune system again comes and attacks the thyroid, but instead of destroying it or inflaming it, it stimulates it. So they're stimulating antibodies. So basically this is something that comes out of the blue and it can disappear out of the blue. But while you've got it, you can have symptoms of shakiness, sweatiness, palpitations, shakes, weight loss, hair loss and anxiety. And that's something you talk to the GP straight away, and most good GPs will do the blood test and diagnose it, and most likely they'll refer you to someone like us to have you treated. So the overactive thyroid is one of those situations whereby when patients ring my rooms, even if there's a waiting period to come, we sort of drop everything to see them urgently, because untreated they can have funny heart rhythms, thin their bones, whatnot, and we can treat them so easily. The naturopaths believe that in Hashimoto's thyroiditis, if you change the diet, you can decrease the amount of antibodies in the circulation damaging the thyroid. And I've actually seen that as well. So in patients of mine with Hashimoto's, as well as examining their thyroid, we take a proper history and examine to see, do you have any joint pains? Do you have tiredness? Do you have any brain fog or other symptoms or mental health issues? And we'll often see if a dietary change, such as cutting the cereal carbohydrates, sometimes cutting out lactose, will have an effect on the antibody levels and their well-being, not just adjusting the thyroxine hormone levels. Sometimes blood tests look normal, but then when you go and examine the person, they're not normal, because the blood tests can have a very broad normal range. So what I do is I emphasize talking to the person and asking specific questions. Are you tired? Do you have dry skin? Are you the coldest person in the room? Do you have slow bowels? Have you had weight gain struggles or hair or fertility struggles? Are you and your partner thinking about conceiving in the next few months? They're the crucial questions. Because if there are any doubts, even if the blood test looks so-called normal, I might be inclined to intervene, especially if a pregnancy is planned.